It is a huge, huge honor to be podcast interviewing Kamsiah Haider. And it is 3 a.m. in Kuala Lumpur, Malaysia. And bless your heart for getting up at 3 o'clock in the morning to interview me in the United States. How are you doing today?
I'm okay, Howard. How are you?
I'm doing just fantastic. I'm having all kinds of fun. So let me read your bio. Dr. Kamsiah is a multidisciplinary dental specialist. Her current interest is in digital smile design, which is a new field of her specialization. The DSD, digital smile design technique, enables her to be more exact in her approach to cosmetic dentistry. She works closely with a few local labs and the DSD lab in Madrid, Spain. She also practices bone screw dentistry, which combines dental implantology, prosthodontics, and orthodontics. In 2003, she did a course in orthodontics by the Academy of Dental Science in Malaysia. She works part-time in an established orthodontic clinic from 2004 to 2011. She earned her membership of the International Association for Orthodontists, the ICOI, in 2014. She did her mini residency with the now well-known expert and bone screw Dr. Chris Chang in Taiwan. Dr. Kamsiah obtained her dental degree from the University of Malaysia in 1987 and became a tutor and lecturer in the Department of Prosthetics, Faculty of Dentistry. She went to do her master's in prosthetics and gerodontology graduate degree at Scotland's University of Dundee, graduated in 1990. She has been a diplomat of the American Board of Prosthodontics and Implantology since 1997. Dr. Kamsiah was a full-time lecturer at the University of Malaya and an associate professor at the International Islamic University and lectures on prosthetics and gerodontology. Her dental implant journey started in 1990 when she attended the course in the University of Gothenburg and the Brandmark Center in Sweden and trained under the supervision of the late Nobel laureate Professor Brandmark, and subsequently in 1994 did her sabbatical in Perth, Australia with Dr. Patrick Henry, who's an associate and colleague of professor. She practices guided surgery in her implant cases. She also lectures on removable prosthesis, dental implantology, especially on immediate loading and the all-on-4 concept. In 2013, on the introduction of Dr. Patrick Henry, he was retiring. She went to Lisbon, Portugal. She did a mini residency training with Dr. Paulo Melo of the world-famous Melo Clinic. Dr. Kamsiah has been in private practice since 1996. I mean, you are a legend. You are a legend. I mean, congratulations on just an amazing career. I don't even want to know where I would even start with you. So let me we can talk about anything you wanted to, but I always try to guess what people are going to be wondering, and they're probably wondering, what is the bone screw technique?
Bone screw technique, the one that I learned is the temporary anchorage device. Instead of using the external headgear, we use mini screw for more of like cases where you need to use headgear before. So you can retain the position of the teeth better. Instead of using the external headgear, we use mini screws as a temporary device.
Very, very interesting. So tell us about digital smile design.
I think this is one of the best things that ever happened because I was always looking for the missing link in dentistry, all the while, there's something that I feel that is not enough, something that really doesn't gel, like you're guessing, and sometimes you have to redo or you have to repeat your cases. The first time I met Christian Koshman was in New York, 2013, but it doesn't really get to me. And I started reading about digital dentistry, and I went to one of his courses, and I find that this is the missing link that I was looking for. This is actually the missing link. And the link is that how to integrate into different formats. You can see patient from a 12 o'clock view, from the frontal view, the stretch view, and now you can decide, when you look at a patient, you can decide, is it a veneer case or is it an orthodontic case? And I use DigitalSmileDesign in most of my cases now, even in completely edentulous cases, in full dentures, in implant cases, in perio cases. When I design, I have that in mind. The concept is there. So I use that as a baseline. And from there on, I've been practicing digital smile design. And I find it really, really useful.
How could Dental Town be honored enough to get you to create an online course for us?
You have Christian Kochman then?
We do, but you are Kamsiah from Malaysia, and I think that would just be so amazing to have a course from you. You're a legend, and to have a course from you all the way from Kuala Lumpur, Malaysia, I think that would just be beyond romantic. That would just be so cool.
Really?
Yes, I do. I really do. And I think that'd be interesting. And I think that that's what's so fun about the internet. It shrinks the world down into your laptop, to your cell phone. And it's so exciting to be able to be listening to dentists all around the world as if you were next door to me.
Exactly. That's where I actually met so many of my new friends, my new dental friends from Dental Town. I met Corey Glenn, I met Arman, I met a few other guys from Dental Town, and I learned a lot from them. I keep on communicating with them, keeping in touch, asking them questions, and even I send my cases to America as well.
So and a big shout out to Corey Glenn. I hope he probably doesn't have time to listen to us now. We wish him well.
Exactly.
He is one of my idols, and he got sick, and he's gonna beat this little sickness. And I think about him every day. I think about him all day, every day. So one of the things different when I got out of school, we both got out of school in 1987. I know you look young enough to be my daughter, but we actually graduated at the same time. Um, back in 87, all the cosmetic dentists, all they could do is file down teeth and do crowns and veneers. And I love seeing the true cosmetic dentists like yourself who incorporate orthodontics, because I really believe that you can't even call yourself a cosmetic dentist if you're not mixing orthodontics into it, because when you just level and align the teeth, you save so much tooth structure from being filed down doing veneers and crowns. Do you agree with that?
Exactly, completely. When my son was about 12 years old, he refused to have treatment by anyone else. He just wanted me to treat him. So that's how I get into orthodontics. So later on, I discovered that, with minimal invasive, and I can move the teeth a bit and plan my crown or veneers or implant that way. So with ortho in mind, you can plan your cases better. Always think ortho, how the position of the teeth, the sizes, where to move it. Sometimes you only need to move one segment. You don't have to move the whole dentition, just a segment, or to intrude the teeth either by using bone screw, and later on you can do your gum contouring, So it really helps if you think ortho as well. That's why I incorporated my orthodontics and DSD together. But my mind, when I look at a case, I will think ortho first.
I agree. So you talk a lot about learn, unlearn, relearn. What do you mean by learn, unlearn, relearn?
Because in the 21st century, Harvard, most of us can read. In fact, in Malaysia, the rate of literacy is almost 100%. But it's unfortunate if we can't learn, unlearn, and relearn, or we can't reinvent ourselves to be a better person by acquiring a new knowledge to incorporate into our daily practice. In whatever field we do, we must always learn or unlearn than to be dogmatic about certain things. That's the reason why I believe that we should learn and unlearn.
And what do you mean by expensive dentistry, expensive dentist, expensive looking dentist?
The expensive looking dentists are like Steve Simon, Christian Kosher.
Well, are you saying that in order to do the high-end dentistry that you need to have a certain expensive look?
No. You just need to have good teeth.
You need to have good teeth? You have
Yes.
You have beautiful teeth. So were you
Without
What's that?
ortho.
With ortho, you had ortho, you're going to
Without.
So were you born in Kuala Lumpur?
No, I was born in a little town in southern of Malaysia, actually. I came to Kuala Lumpur because I came to study here.
You came to study there. I'm going to be up.
Yeah.
I'm going to be up the street from you in next month, lecturing in Singapore.
Oh, really?
How far away is that from you? In
1 hour flight.
a 1 hour flight? Yeah,
Mm-hmm.
Do you go to Singapore very often?
Not really, because their currency is too strong.
Their currency's too strong, so I would save money if I went and visited you instead.
Exactly.
I've noticed a lot of people refer to you as a diva in dentistry, and I see a lot of. Have you heard yourself being called diva, a dental diva?
No?
By yeah, lots of people when they'll list like divas in dentistry, and your name will come up, and I think that's because when I was in school, dentists were mostly male in the United States. And now half the graduating class is female. And I was wondering, when you got out of school in 87, what percent of the class was boys versus girls?
Oh, in my group, there's only one boy.
There was only one boy. Now, see, so are most dentists in Malaysia women?
Most dentists in the government services are women, but in private practice, they're mostly men. Men would go into private practice than the government service.
And why is that different for women?
I think women would prefer to have a monthly paycheck, have a more time with their family than to be committed in the practice.
So
Probably like in America, you have probably some women would prefer to go into corporate dentistry. But in Malaysia, the government of Malaysia actually provides free dental care. And most of my friends, most women would prefer to work in the Ministry of Health than to open their own private practice.
So what did you do? Do you work for the Ministry of Health or you have private practice?
Me now, my own private practice. I never worked with the Ministry of Health. Upon graduation, I went back to dental school to be a tutor, and I continue. I went to Dundee to pursue my postgraduate after that, and I came back and teach again until 1995, I think, and I quit.
So what do you prefer more, private practice or teaching?
Teaching.
Teaching?
Teaching, research.
Will you make some courses for us on Dental Town? Some of your teaching? I mean, I've seen so many of your cases. I mean, you're an amazing dentist.
Thank you.
Do you think you might
I will try.
You will try to do that? That would just be so fun. So how did you so you work closely with a few dental labs DSD lab in Madrid, Spain. How did you find a lab all the way in Madrid, Spain, all the way from Kuala Lumpur, Malaysia?
Well, after meeting the Coachman brothers, I keep in touch with them, and I keep posting them questions. And when they saw that I have a little bit of problem about my DSD, not in terms of design, but in terms of implementing it. So they were looking at the labs. The nearest lab for me to send is in Spain, not in Brazil.
Yeah, Christian Coachman is from Sao Paulo, Brazil, correct?
Yes.
Yeah,
Yes.
yeah. Now, do you refer to him as the inventor of DSD? Would you say he's the founder of DSD, the technique?
He and a few other guys, I think, architect.
Yeah, I think there's about a dozen dentists in his family, isn't that right?
Yeah, a sixth generation of dentists.
So now, are you a general dentist or do you specialize?
Well, if I were to say I specialize, I can, a specialist usually limit themselves to one practice like endodontist. Yeah. But I think my basic is more on prosto. I'm a prosthodontist. But later on, implant and cosmetic dentistry are not considered as a specialization. Yeah. So, well, I call myself more of a prosthodontist.
More of a prosthodontist. And what tips would you recommend to general dentists that are trying to be better in prosthodontics? What common mistakes do you see? What do you think they could do to become a better dentist like you?
Occlusion. Understand occlusion.
And tell us your thoughts on occlusion. Well, I know there's a big controversy in the United States. I mean, there's so many different occlusion camps, and maybe two of the larger ones are neuromuscular dentistry versus Pinky Dawson occlusion. What camp would you consider you fall under?
Mine is more on the muscle. Muscle, the even from my prosthetic training in Dundee, we don't actually go into centric relation. We don't use very high cuspal teeth. We use more of a very low cusp teeth so that patient could actually find their own way than to actually push patient into a position where they're not happy to be with. So let the patient relax, and we look for that. We let patient relax, and we find that we don't have to push so much or trying to ask patient to retreat to the maximum possible position.
I've always read that a 0-degree incline teeth is so much, patients prefer that so much more than say a 30-degree incline teeth. So
Exactly.
so you're saying
True.
occlusion is better if it's less inclined teeth.
Yeah. Especially on the lower flat ridges, I mean, it's really, really difficult to have those kind of cuspal inclined teeth. So I would go for centric occlusion rather than centric relation.
And what percent of your cases or when do you think a dentist should switch to full mouth impressions and mounted on an articulator with a face bow transfer? Do you do that on all your major cases, or do you think that's overkill?
Overkill. Overkill. Especially with digital smart design, you can have a digital face bow. You can immediately take the photo of your wax ring and put it into your computer to see whether you have the line, the inclination right or wrong. It's very fast. Then to actually, I mean, if you use a semi-adjustable articulator, it depends on how you practice. And even if you can do it, like for me, even if I can do it, but I can't find a lab who can do it, I'm not going to stress myself anymore. I used to, when I was younger, I used to try to do all my cases that way. But after some time, that I will follow what the technician can do. What the technician can do, then I would just, I try to go along, and we see from there. As long as it doesn't canter, there's no midline shift, and it's aesthetically pleasing, patient can chew, it's stable, there's retention, there's stability, there's aesthetic, that's fine.
So would you say that when you switched to digital smile design, you basically stopped using a face bow transfer and a semi-adjustable articulator?
No, I still would use. That will help immediately. Immediately meaning that when you have the wax stream in the mouth and you just take a photo and suddenly you realize even the midline could canter. The midline can canter, or the wax stream is not balanced. The buccal corridor, you can't see it properly. Or it could be just a straight line instead of following the smile curve. But the actual mechanics of doing waxing up, you still need to have an articulator. You can't do it on unless you have a digital setup. You have a digital lab who can do a complete dentures all digital.
Okay, I agree. That's interesting. So if someone's listening to you and they say, I want to learn more about digital smile design, what would you tell them?
I say, go for it. Look for them and bring your computer and learn from them.
And where would they learn this on their computer?
Well, they have to attend proper courses. And now it's not limited to those from Brazil. There's so many other sub agents of them, who are teaching worldwide.
And what would you say to so many you're talking to a lot of younger people. We're in our 50s and they're most people listening to these podcasts are younger kids under 30. If they didn't learn orthodontics in school, what would you recommend that they do? What should they learn?
They can go to Dental Town.
They can go to Dental Town. Oh, thank you. You're too kind. Well, they see all kinds of different courses. Like out of London, they see TIFF teaching Inman aligner. They see 6-month ortho, 6-month braces. Ryan Swain, Rick DePaul. There's Richard Litt. There's so many courses. Is there any camps of orthodontics or courses that you like or would recommend to some kid trying to get into a little more orthodontics?
But over here, the one that is very popular is the one from Taiwan. And many Malaysian dentists, many Asian dentists from Singapore, Cambodia, Indonesia, we will go to Taiwan and learn.
And who is that by?
Dr. Chris Chang.
Chris Chang?
Chang.
Cheng? Is he a friend of yours?
Yes, he is.
Is he on Dental Town?
I don't know. I should ask him. He travels around the world.
Can you email me, howard@dentaltown.com, and CC Chris Chang, and we'll see if he can get some courses on Dental Town?
Yeah, he's good. His video, there's 5 million viewers. And patient actually would bring the video and ask me, can you do this? A class 3 patient will ask, can you bring back the jaw without having surgery? Can you do what Chris Chang is doing?
And he's out of Taipei, Taiwan?
No, he's probably about 100 kilometers away from Taipei. He's in the Silicon Valley of Taiwan. He owns the Apple Store.
The Apple Store? Does he?
Yes.
That's awesome.
Yeah, he's not only a famous orthodontist, but everybody in the immigration would know him as a owner of an Apple store.
Is that right?
Yes.
That's
He
fantastic.
will be awesome. He will be really, really awesome to be in Dental Town. And when I actually learned the Diamond system from the Diamond Center in Anaheim. I went to Anaheim to learn about the Diamond system.
The Damon system, the Daimon.
DAMON.
And tell us what the Damon system is.
This is the self-ligating system.
The self-ligating system.
Self-ligate, yeah,
And who sells that? Is Damon, is that owned by Kerr or is that its own company?
own company.
And it's right there in Anaheim, California?
Yeah, it's Omco actually.
Oh, it's
Omco.
Ormco. Okay, so Ormco is owned by Kerr, owned by Cybron, owned by Danaher. So it's their Damon system is a, you said it's a Cybron, or what did you say? Ormco?
Omco.
Huh. And tell us about the Damon system, the self-ligating system.
Well, I find that it's the passive ligation is it doesn't cause so much pain to the patient, and that we're not using rubber band, and it's more hygienic. It's easier to use. They have talk. They have talk for every cases. Like if you are on a class 2 cases, they use a lower talk, and they have talk for all the upper anteriors, upper six, the upper canine to canine. They have special talk, and you can see result very fast.
And how long have you been using this system?
Well, since about 5 years ago.
5 years ago?
Mm-hmm.
And you really like it a lot, huh?
Yeah, I like it a lot, but it's quite expensive actually.
It's expensive?
It is.
So tell us about that. So you're in Malaysia. That's 30 million people. So that's the same number of people as California or Canada. About 80% of my podcast viewers are from the United States, and the other 20% are from about 134 countries. But you've been all around the world. What is it? What is it like? What is Malaysia like, and what is it like to be a dentist in Malaysia?
Well, I mean, it depends. As you know, as a dentist, it depends on how much dentistry you want to practice. If you want to be a part-time dentist or you want to really be a full-time commitment, you can do that. And I think to be a dentist is a really great job. It's a good job because we continually have something new to learn. There's always something new to learn. And I think it helps. It helps our mind to be active. And I can't be sticking to prosthodontic or just implant by doing orthodontics, by doing self-ligating, and then doing a bit of aligners, understanding DSD. It's very challenging. You know, you read a lot, you research a lot, you find out more. You can, and then when you see the differences in your work, you can see that what you can do before and what you can do now, and how you improve yourself with the continued education, how you self-educate yourself, you know. Now, with internet, even the first year student, they can see a dissection, they can see beautiful anatomy from internet. During our time, we have to go to libraries, you know, we have to spot the book, you know, find the book, buy the books, things like that. But now, people can always learn. I can always go back to my anatomy, to my physiology, to pharmacology, just from internet. You can look In fact, I met so many young dentists who are lazy to read. They say, yeah, they just go to YouTube. They say, oh, where do you get that? You know, is it on YouTube? I said, no, you have to subscribe to Dental XP. So it's not free. The free ones are a teaser, just a teaser. But the real one, if you want to learn, really learn, you have to subscribe and you have to pay. And one of the great sites is Dental XP. The digital smile design, they don't have it on so much on YouTube because they make people pay to watch their online videos.
That's true. You got to have a business model, and it's hard to have a business model on the internet because everybody on the internet expects everything to be free.
Exactly.
I think that's why
But nowadays, if you have an iPad and you have an iPhone, you can even though it's a paid site, you know, you can videotape the whole video. Even they are making it difficult by not allowing people to double click or to have a simultaneous click or people sharing the email. But usually people can still record it.
that's true. There's an app for everything. There's basically an app for everything. You also have a degree in gerodontology. Is that geriatric dentistry, gerodontology?
Yeah. Yes, geriatric dentistry. Well, in Scotland, they have a lot of elderly people. They have a lot of edentulous people. So I was working in a geriatric hospital. I was doing my research on complete dentures. And my professor is quite known for his replica technique. He replicates dentures so that those in the geriatric centers, you know, they will always lose their dentures. The English, the Scottish, they like to have tea at night, and they will boil the dentures together with their teeth, or they will throw it in their laundry bag. So they came up with this replica technique. And it happened to be the best thing that I learned because after that, when I learned implantology, during that time, we were doing mostly on a complete edentulous cases. And you must have a good understanding in constructing a good dentures before doing an implant. You can't compensate implant by doing an overdentures. If your dentures are not good, you must have a good denture and enhance it by doing one or two implants. And so in a way that my learning curve has been quite smooth because somehow from mastering a complete cases on geriatric case in geriatric population, and my implant was mostly on fully edentulous cases at that time. Only in almost the year 2000, people start doing single tools, and to perfect the technique was, I mean, it's much later until recently. Until recently, you know that the about the biological width, the papilla, how to retain papilla. Before that, there was not so much of information.
So are you mostly doing implants for dentures, or are you most of your implants in fully indate people who are just missing a single tooth or two?
Fully edentulous.
So most of your implant cases are fully edentulous cases.
Yes, and these are on failed dentition. And those are the people who are scared to move from their failed dentition to wear complete dentures. So this is the market. We have a big market of people who actually neglect their oral hygiene, neglect care, and they're moving. Suddenly they realize that they have no choice. They are only going to have either they're going to wear complete dentures, and they are afraid of wearing complete dentures. So there's a market segment on field dentition moving edentulous where patient doesn't want to wear dentures.
And do you like to remove all of their teeth and let them adjust to dentures first and then go back and add implants? Or do you like to
If,
remove
if
the teeth and do implants immediately and go from all your teeth to on all on four?
Well, it depends. As I said, most patients, they are afraid of, they don't want to wear dentures. They don't want, unless that if I find that now, uh, most patient wants everything fast internet connection, fast dentistry, everything, 1 day, 1 hour, something like that. So we have to get, I mean, if we are thinking about a business model, you have to learn. You have to cater to the market.
And so are you doing mostly all on four
Well,
implants,
I used
or do you do implants with a Haider bar or a Dolder bar? Do you ever do mini implants? Talk about the different types of implant scenarios that you like to do.
well, I don't do mini implants.
You do not do mini implants.
No, I don't do mini implants. Um, the overdentures when I was teaching, two two implants, overdenture, ball attachment, bar, but the clips always giving problems, things like that. And now I would convert them to fix anyway, or I would just convince them just put a few more. If they want to do two, I think I would rather do one. You can even do one overdenture, one implant overdenture ball attachment. You don't have to have two. Why have two instead when you can have one?
You just
And you can have one.
you just put it right down the middle.
Yes,
And
it's
you
very
do you think that's better than two?
yes, yes.
And why is that? Just because it can rotate easier?
This was a research done by uh, Professor Patrick Henry. They did a long-term study, and they find that one implant is better than two.
That is amazing. Would you mind starting a thread on that? In Dental Town, we have 51 forums, and one of them is implantology. Would you mind going under implantology and posting that study? I think that would be
Okay,
a great discussion
okay,
because, where I'm at in Phoenix, Arizona, I don't know anybody who's ever placed one. I don't know anybody. I mean,
exactly.
yeah, everyone always does two or four.
Mhm,
They usually do
mhm,
two with a ball and O-ring, or they'll do four with a bar. I
mhm.
don't know anybody who's ever done one. Have you been placing? Have you done one?
My professor in Australia, he's the one who's doing it, and I learned it from him. If patient has like really limited amount of money or very old patient, frail, and you can just do them a great service by just putting one implant.
My brother just moved to Australia. He moved
Ah,
he moved from Kansas all the way to
mm,
Sydney, Australia, and oh my gosh, is he loving that? I don't think he's ever going to
yes.
move back home to Kansas. I think he's got my mom and all my sisters sad because I don't think you could move from Kansas to Sydney, Australia, and then go back. This is kind of a one-way
I
street.
live in Perth. I live in Perth for a while.
Oh, now Perth is my favorite in Australia. I'm
Yeah.
on the one coast is Melbourne, Sydney, Brisbane, Gold Coast, and then clear on the other side. I
Mm-hmm.
mean, just out in the middle, clear on the other side, about 3 hour flight from Antarctica is Perth, and I think that is the
Mm.
coolest city on earth. Did you like that?
Yeah. Of course, I love it.
You think would you rather live in Kuala Lumpur or Perth?
Perth.
Is that right?
Yes.
So how come you don't live there then?
Well, I have my mother, I have my family here. I was married at that time.
See, that's why I want to go to Perth, so I'll never ever have to see my family again.
You're bad. Would you bring Ryan with you?
I'm just would I bring Ryan with you? Get over here and say, oh my God.
I hope I can go.
I always tell my 4 boys that they're the only 4 mistakes I ever made.
Oh, poor thing.
I'm just kidding. I'm a big teaser. So okay, so we talked about the single implant, which I really wish you would post that study or post a case or what have you.
Okay.
And you know,
Okay.
and you know another reason why I really want you to do an online CE course on Dental Town. You know why I really want you to? We have
Yes.
we have 210,000 dentists on Dental Town. You know, 50,000 downloaded the app on their phone. I've done how many podcasts have we done, Ryan? Today we've released our 300 podcast. My number one complaint that I always get is from the dental schools. They always send emails. They always say, how come every time you publish an article, it's by a man? If you publish an article by a woman, it's a hygienist or a dental consultant. How come every time you interview someone, if it's a dentist, it's a man. If it's not a dentist, it's not. If it's a woman, it's not a dentist. And I think that in this country, you know, you go to many countries, and the majority of dentists are women. I mean, so many countries, you'll go to their country, and you'd walk away thinking all dentists were women. But in the United States, 25 years ago, it was mostly men. And now it's half women, and I think they're starving for women role models. And I think young 22, 23-year-old girls in dental school don't want to listen to a bunch of short, fat, white, bald men. They want to hear from, and like I say, I think your work is actually world class. Hell, you've gone all around the world learning this stuff. Let's go back to implants. Do you do the all on 4?
Yes.
Can you
I do.
can you explain what that is? There's some kids listening to this that might not understand what the all-on-4 implant system means.
All on 4 concept. It doesn't mean like just 4 implants. It's a concept. Basically, the concept is immediate loading and using the Palo protocol. But nowadays, there's a lot of people who modify the technique, not using this protocol, and claim failures. So that's why I prefer to learn from the person himself. Like when I learned the SD, I learned it from Coachman. When I learned the single tooth overdenture, I learned it from Patrick Henry, who invented the design. When I want to learn about all-on-4 concept, I learned from Palo. And when you go around the world, you see all-on-4 clinics, but they're using internal hacks, they're not using the protocol, and they're having problems, okay? So it's unfair if you are not learning properly and you have problems and blame it on the technique just because you can angle the distal implant doesn't mean that all system you can do that way. And if Palomalo can do it as immediate loading because he has his protocol. He did 1,000 over cases before he published all this. And I've seen how he worked. He worked like, he used left hand for the left implant, right hand for the right implant. And he doesn't use any guide. And he goes in, he says, oh, I said, where's the design? Where's your guide? I was silly, I was just asking him. He said, oh, we shall see. We shall see. So, okay. So I look and I see that, the way they put implants, like, very systematic. If they know that they can't get enough loading or the AP spread, they put 5 or 6. Or they use zygomatic implants, and their oral hygiene protocol is very strict. The design is also very strict. The amount of bone that they trim and all that are taken into consideration. Some people are using internal hacks or they mix it, it's a big issue everywhere. You know, everywhere when I go, I see how people present or condemn. I think that's not fair. And it's not cheap to learn from Paulo Malo as well.
And he's in Lisbon, Portugal, right?
Yeah, his clinic in one of the clinics in Lisbon.
Is that where you went?
But yeah, I went to Lisbon a couple of times.
Did you know that was the first city I ever went to outside of the United States? And I
Wow.
went. You know why I went there?
Mm-hmm.
In our high school, they would rent a 747. They filled it up with about 500 Catholic high school boys, and they would fly them to Lisbon, Portugal, to go spend 2 weeks at Fatima, because every time they did that trip, they could talk about 15 to 20 boys of not coming back home and going straight into the seminary to be a Catholic priest. So I got a
Mm.
free trip to Lisbon, Portugal, and they didn't get a free Catholic priest out of me, but I sure did have fun in Lisbon, Portugal. That is a beautiful place. So, are you good friends with Dr. Malo? Dr. Palo?
Yes,
Malo?
yes,
Can you
yes.
introduce us too? Do you think we could get him to do an online C course on Dental Town?
I can ask him.
I think that would be an amazing course, because I think the all on four, like you say, that was started with Noble Biocare, wasn't it?
Yes.
And
And
so,
he patented the concept.
yeah, and like you say, there's a lot of people who are doing different versions of the all on four, but what you're saying, it's not the same protocol with the same success. Is that what you're saying?
Exactly.
Yeah, and I think it would be world class to hear from the horse himself on a course on Dental Town, what his protocol is.
Yes, exactly.
I think that would be amazing. And he's got a big audience. There's 210,000 dentists on that site from all around the world, so it'd be a great introductory platform. And then if people could watch
Mm-hmm.
that, and if they wanted to learn more, they could fly to Lisbon, Portugal, and who knows, maybe they'll learn how to place implants and become a Catholic priest at the same course. Does he do that on the side? Does he have an implant Catholic priesthood course where it's a mixed?
I, I know that he has a wine factory or some orchard.
He's
He
in a wine.
produces wine.
I think
Yeah.
I think all Catholic priests drink a lot of wine. I don't think I've met one that doesn't. Um, so what percent of your practice is all on four implants? I mean, is all on four the majority of your implants, or is that just one treatment protocol that you do?
One treatment protocol. It depends on cases. If like, I mean, I prefer to do all on four. I like to do all on four compared to other cases.
Now that's
I
a
don't like to do.
now in his protocol, do you have to use, or do you use Noble Biocare implants?
Yeah, he has his own Nobel Speedy. It's almost like the old Bronema implant, but he came out with Nobel Speedy.
And you Nobel what?
Speedy.
Speedy? Like SPE,
Speedy.
like SPEEDY?
Yeah,
And that's your favorite for the all on four?
yeah. That's his implant.
And that's what you use?
Yes.
And you also you train with Dr. Brandmark.
The first time.
And
The
he
first time.
and he just passed away last year.
Yeah.
So what was he like?
Not last year, the year before.
Yeah, what was he
The
like?
year before. Hmm. It's, well, I can't really remember, 1990. And he came to Malaysia in 94 or 93, I think.
Yeah. You've
Mm-hmm.
so you've studied in how many countries have you trained in? You trained in Sweden, in Portugal, in Australia, in Malaysia, in Anaheim. I mean, you're
Taiwan.
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 Taiwan. You're a world traveler. Do you do that because you like to travel, or because you like to learn, or you just like to mix them up and travel and learn?
No, I just like to learn. I don't actually travel. I mean, for fun. Most of the time when I travel is that I mean when in my younger days, yes, I travel a lot for fun. You know, just travel with my kids, things like that. But now when I travel is because I'm attending a course or I'm giving a course, things like that. I don't like to travel anymore.
Did you like going to Anaheim in California? Did you have fun there?
Yes, I do.
Did you get to see Disneyland?
No, I didn't.
You didn't? Oh my gosh. You might be the first person that ever came all the way from Asia to Anaheim and skipped Disneyland. I think you might be the first.
Because when I asked my husband, would we go on the roller coaster, things like that, he said no, he won't go. So I said, okay, then I'm not going. But when I go there, I attend the course. He was not attending the course, so I don't know what he did. He probably go and to the bookshop or something like that. He studied in George Washington. He studied in America, my husband.
He's studying there now?
No, no, he studied in George Washington University.
Yeah, what is he? Is he a dentist?
No, he's a MBA,
Oh, an
econ.
MBA.
Mm-hmm.
I have an MBA. I think I enjoy economics as much as dentistry. I really, really love economics. Do you enjoy economics?
I listened to your MBA, and it makes sense. And my two children study accounting.
So you listened to my 30-day MBA on did you
Yes,
listen to that on
yes.
iTunes or YouTube? Where did you listen to that at?
To your podcast.
Okay, yeah. Yeah, I put that up on
Mm.
there. So back to gerodontology. There's the extraction of all the teeth and doing the all-on-4 implants, but what else do you think our listeners should know about gerodontology? Because elderly people, in fact, I just read last night the fastest growing segment of the by percentage only is people that made it past 110. The second is people that made it past 100 because percentile wise, I mean, old people is the fastest growing segment of the population. What do you think general dentists should know more about when treating elderly?
Well, the treatment are almost the same, just that uh, you, I mean, you have to deal more with the family and whoever the caretaker who bring them in. But Malaysia is still fortunate, you know. Not many of us send our parents to the old folks home or geriatric centers. And most of my patients, they are brought in by their children. And I make sure that the children will understand what treatment that the father or mother needs to do. And if they can, they will still come for cleaning, for hygiene, and if there's caries, we take care of that. If they need, I try not to make a new denture because it would be very difficult to have a new denture at that age. If I need to do a new denture, then I would just replicate the old denture and give them a new one. So you will see the young dentist will see more of the elderly patient with teeth now than before. Maybe some areas, some population, we have a lot of old people with dentures, but we are seeing more and more patients with teeth nowadays.
Yeah, I don't have to worry about an old folks home because in the United States, only about 5% of Americans will ever live in a nursing home or an old folks home. It's only about 5%, but it's almost
Mm-hmm.
entirely women. Because
Because
men
they live longer.
because they live almost 5 years longer. I'm very lucky. I'll probably just drop dead of a heart attack in the kitchen and probably grabbing a piece of cheese and a beer out of the refrigerator, just fall over dead. But those darn women, they just keep living and living and living. But yeah, you go into a nursing. It's only 5% of Americans go to nursing home, and it's almost all women. So what? And when I go into the nursing homes, and I've got into a dozen of them within 10 miles of my dental office and home. It seems like the number one problem is root surface decay, and the research is showing that it takes out that when you put a lady into a nursing home in America, they get about one root surface cavity per month that they're in there. So by the time they've been in there 1 year, they have 12 new cavities. Do you see much root surface decay, and what are your thoughts on root surface decay? How do you prevent or treat that?
Well, if I mean, to prevent is still the same: oral hygiene, whoever taking care of them, the brushing, the interdental cleaning, the rinsing. But if there's cavity, I just place glass ionomer, just a glass ionomer on the root surface.
And why? I think that's so interesting. You said glass ionomer. When you look at GC out of Japan and glass ionomer, it's huge in Asia, Australia, New Zealand. You're in Malaysia. You just mentioned it, and yet Americans they hardly ever use it ever. And like most Americans, if they had a grandma in their office with 6 root surface cavities, they would use just like an Ivoclar, Heliomolar, Tetric, just a resin composite. Why do you use glass ionomer, and do you think that's better than the majority of Americans who would just place an inert plastic composite from Ivoclar?
One, you didn't really have to isolate the teeth, you know. Like if you do composite, you have to isolate. Imagine putting rubber dam on an elderly patient. They will probably get nervous and try to pull it off or something like that. So, the manipulation of material is easier.
Do you think the glass ionomer is more antibacterial and prevents recurrent decay more than just say a straight resin composite from 3M or Ivoclar?
But nowadays the composite, but it depends on the what structure of the cells at the root level. We are not talking about enamel. We are talking about cementum. It's a different property, isn't it?
Yes. But do you think the glass ionomer prevents more recurrent decay than a standard resin composite?
No idea.
So that's not the reason you're using it. You're using it more from the handling characteristics of being able to place it with more moisture.
Yeah, faster.
Faster.
Mm-hmm.
Now, have you ever gone to Japan? Have you ever gone to the place where they make Fuji or any of those areas?
I've been to Japan. I've never been to. I don't think I've been to the factory. No.
You didn't visit GC?
No.
Because after I get done lecturing in Singapore, I'm going to swing by Tokyo. And
Oh, wow.
yeah, I think that would be fun. And actually, Ryan's going with me. He's I think he talked. Did you talk me into that, Ryan, or whose idea was that? Was that mine or yours?
Is it next month? Is it next month?
Yeah.
Because it's still snowing in Tokyo.
Is it? Well,
Yeah.
we just had the blizzard of 2016 here in the United States, and in Phoenix, it got down to a bone-chilling 61 degrees. Of course, you don't know what 61 degrees is because you probably use Celsius, right?
Yeah.
Yeah, we live in
32 plus, the formula is what? 32 plus something, isn't it?
I think America is the only country that doesn't use Celsius. We're a little behind the times in so many things. So that's our hour. That was the fastest hour I think I've ever done on a podcast. And I really wish you would create some online CE courses because I've seen so much of your work. I think you're seriously amazing at what you do, and I think the young women in dental schools want to hear more from the established role models like you. In fact, I was pointed to you by a dozen different people that says, check out this dental diva in Malaysia. She is the bomb. And so thank you so much for spending an hour with me today. And maybe when I'm all the way to Singapore, who knows? Maybe I can swing by Kuala Lumpur. Ryan, you want to jump a
Yes,
flight and go to Kuala Lumpur? Yeah, maybe me and Ryan will hop on a plane and fly out to Kuala Lumpur. So Malaysia, Kuala Lumpur, is that where the Petro Towers are? The Petron Towers?
yes, yes.
Are those
Yes,
still
the Twin Tower,
are those
the
that?
Twin Tower.
Yeah, that is amazing. So are you close to there?
Yeah, quite close. I'm at the suburb, but it's close.
Yeah, do you go there very often?
Yes, yes. There's a shopping mall, a nice place. They have a park. You will like it.
Oh, I bet I would. I've always wanted to see those. And but thank you so much for spending an hour with me, Kamsiah. And again, I hope you put a course on Dental Town. Congratulations on learning dentistry all the way from Australia to Lisbon to Taiwan to America. You're such a role model of what dentists have to do, and that is dentists. When you become a dentist, you've committed a lifetime to continuing education. I mean, you just can't walk out of dental school and do dentistry for 40 years. I mean, you just never stop learning, do you?
Exactly.
And
Once you stop learning,
on that note, I hope everybody listening this today learned, unlearned, and relearned something new.
yes.
Thank
Thank you,
you,
Howard.
thank you, Kamsiah, and thank you
Bye.
so much for getting up at 3 o'clock in the morning to do this. Are you going back to
Thank you.
bed? Are you going back to bed? Or
Of
yep.
course.
Okay. All right. Night night.